Good morning, everybody, and welcome to the next session of the LMI series, What's Happening in Essex. Today is part 2 of the health and social care session, and we've got the NHS here to run the session, the Mid and South Essex Health and Care Partnership. So thank you very much. You've got lots of speakers here today. You're joined by lots of guest speakers. So really hope you enjoy the session. As always, the session's recorded. So if you don't want to be on camera, please turn your camera off. But we will have 15 to 10 minutes at the end of the session, probably more like 10 minutes to answer questions. So if you have any questions throughout the session, pop them in the chat box and we'll pick them up. But over to our first speaker then.
Thank you very much, Rachel or Rosie. Can you just move on to slide 2 for me, please?
Oh, sorry.
That's fine. Oh no, sorry. Yeah.
Sorry, I'll go into slideshow. Sorry, I'd forgotten to do that.
Thank you very much. Good morning, everybody. My name is Rachel Gray. I'm the Work-Based Learning and Apprenticeship Lead at Mid and South Essex NHS Foundation Trust. And we became a merged organisation in April 2020, and we have 3 acute hospitals. We have Basildon, Southend and Broomfield, which is just on the outskirts of Chelmsford. I've just got a couple of slides. I'm just going to take you through some key points about different roles that we have within our acute service. As you can see, there's a variety of roles within the NHS. We've got over 350 different careers, and a lot of those have career pathways as well. So ranging from sort of like your nursing and midwifery right through to allied health professionals, which is physio, therapist and occupational therapists, and also some non-clinical areas as well. For example, our estates and facilities department. In terms of the pay scales within the NHS, we work on an Agenda for Change pay scale, and this is available just by undertaking a Google search. And you can see the different pay bands and the increments within those bands. So, for example, a band 2 will start on around 18,546. But as they progress through the years and skills and knowledge, then their pay will increase. So take a look at that if you wanted to see how that scale works. As it says on the slide, doctors are on a different pay scale. Next slide, please. Thank you very much. So there's lots of roles within the NHS, as I said, and a number of these have career pathways. I'm just going to focus on our healthcare assistant support worker role. So I'm not going to kind of read through everything on the slide because I think these slides will be shared afterwards. But these are a key role within our acute service, and they support the ward staff, and we do have a career pathway where a healthcare assistant can train to become a registered nurse through the apprenticeship route. So it's ideal for those individuals that are looking to sort of like progress their career, but may not wish to go down the university route, or may not be able to afford to go down the traditional route to become a nurse. As it says, we have different specialisms for the healthcare assistant, and they work in our medicine and surgery areas, as well as theatres. Most importantly, really about coming into the NHS is that you just need to sort of like have that kind of caring attitude, really. As it says, you don't necessarily need to come in to us with specific qualifications. Sometimes we will be looking for some experience which can be gained from working either in a care home. We employ a lot of staff from the care home environment, or on a voluntary basis as well. It's just really demonstrating that you have those skills and knowledge. Just before I finished, just going to highlight about where our vacancies are advertised. We have our own trust website, and we use NHS jobs as well as some social media platforms and Indeed. That's it for me. So I'm going to hand over to Nigel, I believe.
Good morning, everyone. My name is Nigel Hughes. I'm the Professional Training and Apprenticeships Manager, and I work in the Essex Partnership University Foundation Trust. And we are a specialist mental health and community service, and we cover the whole of Essex. Mental health and learning disability services are provided within inpatient services and community-based services, and in partnership with other services linked to those areas of expertise as well. We also offer our psychological services, our improving access to psychological therapies, which is for people that don't require secondary services at that moment in time, but are experiencing mental health difficulties. So mental health, community services and learning disability services, we have a wide range of career options, and they are across all services, and that's clinical and non-clinical options. I think sometimes we often forget about the non-clinical options available around the health service as well. But within our specialist services and mental health services, our options, we have mental health nursing, learning disability nursing and adult nursing opportunities. We also offer psychological services. We offer our IAPT wellbeing practitioners training, high intensity therapists. We also have occupational therapists, art, drama and music therapists across the organisation. So obviously it's in our interest to look at how we develop those pathways to train and bring staff through to develop our staffing pool and our future workforce. Mental health and learning disability services are also supported by social workers. We have employment specialists and activity coordinators, and we have those support from our third sector partners in actually supporting service users prior to hospital admissions and also upon discharge. If we can move on to the next slide, please. Our traditional routes into nursing are obviously supported via the university options, where people and students require access to A-level courses and level 3 qualifications. But with Iniput, we're actually very proud to say we are actually an apprenticeship provider in our own right. We are a main provider, and we offer our pathway starting from level 2 within the healthcare support worker programme, and this takes us all the way through to where someone can actually go off to university for the last 18, 22 months to actually gain a top-up degree in their chosen subject, which could either be nursing or within our AHP partnerships, OTs or physio. We also have a psychological pathway for people who have a psychological degree, and it's called our programme, which is an apprenticeship, and it's delivered in-house, and it allows people to move up into equivalent to a master's level via the apprenticeship route. But as my colleague Rachel was saying, whilst we can offer all this stuff, our values are also really, really important. The people coming through we need people who are caring, compassionate people, and good communicators as well, because we can teach people skills, but they also need to have those ongoing skills on board and really have that drive and commitment to want to deliver high patient care. So that's it from me. Thank you.
Sorry, we can move on to the next slide then. So apologies from Emma White, who was going to be delivering the next session. She would be our lead for social care. She's unfortunately got COVID, so not able to make today. So I'll run through her slides. I probably won't do them justice, but she has put a web link on the second slide. So, or if there is any questions, if you just want to email them to me and I can get in touch with her when she's better. So Skills for Care is an independent registered charity and a strategic body for workforce development in adult social care in England. what does adult social care workforce look like for MSE? So we've got 950 adult social care establishments, so it's a huge part of our workforce across our partnership, with 28,000 jobs across roles including care workers, registered nurses, support workers, registered managers. There's a whole variety. Social care has got a whole variety, just as it has within health. And we have a huge amount of vacancies, which has, as you've probably seen in the news of late, has increased, particularly within domiciliary care and care homes. Average pay is similar sort of starting salary to as it is in the NHS. Care workers start on around 18,000, and then progression route to registered manager at 30,000. Again, it's a very similar career pathway to NHS. You don't always need qualifications. Experience does count, or the entry routes in where you can be trained sort of on the job through apprenticeships. We do use traineeships within social care to gain work experience as well as qualifications at the end. And they work closely with the DWP for people who have perhaps come out of education and fallen into a gap, and haven't been able to get onto employment, potentially because they've got a gap in education or something like that. And sector work academy programs help them get back into the workplace, or that first step onto the workplace. New starters in adult social care would normally begin their careers in sort of your care worker, support worker roles, and then progress up. And there's a very clear career pathway on the website that shows you how you can develop through things like apprenticeships to become social workers, occupational therapist. Many of the roles that are in social care would also, an occupational therapist you'd find in a hospital as well. So it's generally down to personal preference as to which route you want to take. And again, as Nigel and Rachel have both said, that to work within social care, it's very values based. They're looking for people who can show dignity and respect towards their patients, compassion as well. A good communication is obviously essential as well. So there is the web link. If you go on there, I've been on there before, and it's got some really clear examples of career pathways and how you would develop through those career pathways. But as I say, any questions on social care, if you email them to me, and I can happily get in touch with Emma when she's back. Thank you.
Hello, good morning. So I'm Jan Sweeney and I work for the Mid and South Essex Workforce Team, or Training Hub as some people call it. It was established a few years ago, and we provide a range of education, training to support the recruitment and development and the retention of the primary care workforce. We're always looking for people with transferable skills who can bring life experience and insights from working in other sectors. So job seekers should not rule themselves out just because they have a non-traditional background or because they don't have clinical or degree level qualifications. Like my colleagues that have spoken earlier, some roles have a specific training route and they need academic qualifications. GPs, nurses and pharmacists all need to go through that route. But for others, you can study a range of different subjects and apply them to the jobs in the NHS. We've also roles suitable for apprenticeships, conversion courses and on-the-job training. For example, and I think Rachel referred to this earlier, practice might have an HCA or healthcare assistant, or we can support them to join the trainee nurse associate course, which is supported by the Anglia Ruskin University, and this will hopefully encourage those HCAs to remain within the practice once they have qualified. We've got lots of jobs available. They'll be advertised on NHS Jobs website, Primary Care Careers or the Equip websites, and I'll put details of those in the chat later on. But what is exciting in primary care, as the needs of our communities are growing and the population's growing year on year, it's been recognised that we could do more in primary care to keep patients from having to go to the acute hospitals. So last year, some additional funding has filtered down. And if you could change the slides, please, to my second slide, you will see now that there are about 15 or more new roles within primary care. We've received the funding to create a bespoke, more multidisciplinary team. So the practices now, or they're called primary care networks, but I won't go into that. The practices or the primary care networks assess the needs of their local population and work with their local community services, and they make support available to people where it's most needed. So we can now offer patients services like dietitians, podiatry, physiotherapist, all within their local practices or their PCN areas. So what we do as a training team, we help those practices decide how to spend that funding and decide which would be the best services to enhance their services and to help their local population. So there's lots of continued professional development on offer within GP practices. Regardless of your role, personal and professional development helps manage learning and growth throughout their career. Continuous learning helps open new doors in your career and keeps your skills and knowledge up to date, and ensures that the practice is that you practice safely and legally. There's many opportunities and activities that you can take part in to help further your career. There's on-the-job training, courses, workshops, webinars, shadowing and e-learning. We're also, the NHS wants to make sure that everything possible is being done to support staff who might forget to look after themselves. We recognise that the primary care colleagues, both clinical and non-clinical, are continuing to work very hard for their patients. So we've now put on some individual coaching with a skilled and experienced coach who can work with staff to discuss any area to do with well-being. They will listen and ask questions and support that member of staff to develop practical strategies to manage stress and develop positive coping strategies. So the values of the Constitution are, if you work in NHS, working together for patients, respect and dignity, commitment to quality of care, compassion, improving lives, and everybody counts. So you won't become wealthy working in the NHS, but how many people can leave work every day knowing what they did really mattered? And that's it from me.
I think I'm next. Morning everyone, my name's Judy Wren. I'm Senior Learning and Development Business Partner at Provide, and I am also a nurse by background. So I'm talking to you about community services, and within Mid and South Essex they're delivered by Provide Community Interest Company, ePut, we've already heard from Nigel about the Mental Health Trust, as well as delivering community services, and by colleagues in NELFT, which is North East London Foundation Trust, and they cover the southwest of Essex. So community services delivers care in a huge variety of community settings, in community hospitals, clinics, nursing homes, primary care. We've just heard from Jan, some of the settings that are used for primary care also have community services in. And it says here, as well as within people's homes, and I'd like to stress that not everybody lives in a house. And that might sound a bit odd, but community services cover colleagues from the travelling community. They support homeless people through charities and groups. And Essex has a large coastline, so we have a large population of people who live in boats. So those people that live in different areas, different homes, as it were, receive care the same as anybody else would. We deliver nursing and therapies across those community services, and therapies includes a wide range that's already been mentioned: physiotherapy, occupational therapy, speech and language therapy, podiatry, and I think there's about another 10 or 12 professions that come under the banner of therapists. And they're delivered to children, families and adults across that in the various settings that I've already mentioned. My colleagues have already talked about career options being available within clinical and non-clinical functions, and we do offer a number of apprenticeships through from setting foot in the door into an admin or a clinical function, all the way through to being registered in one of the clinical professions, or stepping up the ladder within a finance or a facilities function that also have apprenticeships. So training from, as I've just said, a junior post setting foot in the door of an organisation through to a qualified accountant. I know we've talked about clinical roles probably predominantly, but there's lots of other options. We have everybody works in the NHS is always said. We have lots of formal training routes. Graduate schemes are run across all of the organisations that have spoken today, so people who do graduate through university can come in through that route and step in. There's a large national programme which is very, very popular, and direct entry into the workplace. And it's just to stress that apprenticeships, I'm sure everybody knows, we call them internal and external. So an external apprentice would apply for an apprenticeship role, be paid while undertaking the training. A lot of people come into healthcare and work for a while before undertaking an apprenticeship programme. So there are internal apprenticeships. There are already substantive staff who undertake a development route and a programme to move on in their career within the NHS. So lots of opportunities. My colleagues have already spoken earlier about the wage banding. That is the same across everybody's organisation. So Rachel said first off that that is a simple Google and you can see what those bandings are. Just to say that the qualified nurse, physio, OT, the first level of pay band is a band 5 and then onwards. I think that's all I've got to say about community. I'll just add one more quality, one more value. They've all been mentioned by my colleagues, but I would add in honesty. And just to say that we do stress that everybody who comes into the NHS undertakes a DBS check. So we would expect that to be of reasonable standing to come into a job within our organisations. Thank you.
Thank you. And then the final slides I was just going to talk to you about was the offer of Health and Care Academy, which we're looking to launch in the spring. So Health and Care have come together to promote careers in health across the sector. And a Health and Care Academy effectively offers students an opportunity to learn about careers in health and care and the different entry routes in, of which they are vast and quite sometimes can be quite complicated. So it's to talk to students about those different entry routes in and what those different roles are. Any student that takes part has an opportunity to meet with a range of health and care professionals who would deliver the sessions, called Health and Care Ambassadors. They have an opportunity to ask questions and gain an insight, a real insight into the understanding of the work that they do. So that may be the positives and the negative sides to a role. It might be that somebody hadn't realised that that was shifts, might involve working at night, and and or some of the difficult situations that they might find themselves in that they'd have to and then benefits as well to working in those roles. The Health and Care Academy is going to look at widening participation and playing a role in addressing health inequalities and positively influencing social conditions in an area. So going into areas of high deprivation where we may struggle with engagement and asking people what they want, what is it that would help them to consider a career within health and care, and helping to try and bridge those gaps if there are any barriers to getting into employment and education. So supporting people potentially on a one-to-one basis with a mentor, and increasing knowledge and insights into roles, and that understanding of what, there's so many, over 350 roles within the NHS, which across care as well. So the undergraduate programme, as I say, we're looking to launch it in the spring. We're going to run a first pilot, hopefully with South Essex College, and then we'll be looking to roll that out and offer that to all the schools in our partnership. It's aimed at 14 to 18, sort of 19-year-olds, and the model that we're looking to develop is to offer a first aid sessions for students, which would be potentially 3 sessions where they'd get a certificate at the end of that. They'd get insights into careers in health and care, so actually having sessions with real people that are on the shop floor doing the roles. Then also putting some sections in there on interpersonal skills, around communication skills, how to fill in a CV or an application form, potentially some job coaching on interview skills, talk about the different entry routes. And then anybody that attends those sessions, because we're partnering with the Prince's Trust, they'd be guaranteed a mentor and also a day's virtual work experience. And they tend to be once a month on a Saturday, sort of 10 till 4. These sessions will all be virtual, obviously for the time being anyway, and has been like that for the last sort of 18 months. Obviously we'd like to be able to, in time when it's safe to do so, offer a blended approach where some bits like first aid could be done face to face, and other bits could be done virtually. Anybody that attends the programmes will be automatically entered onto a register for an alumni, where we can keep in touch with those students, make them aware of any changes in the system, any new roles that are coming out, any apprenticeships that have come out, so that people can keep up to date with the way the service is changing. And it's very much a partnership approach, so all of the programmes will promote careers across the system, as we have done today in today's presentation. So there'll be representatives from primary care, social care, mental health, and the acute sector and community. Okay, I think that's all our slides. Any questions?
Thank you so much for all of them presentations. I mean, I feel really lucky that we've got you all here together to explain the different parts within your organisation. So thank you very much. Any questions, please do pop them in the chat. Fiona's just popped in saying fantastic session. Thank you so much. Yvonne has popped up her hand.
Oh, right. Yeah. Hi. Yeah. Thank you very much. I'm a enterprise coordinator in Thurrock, but I also deliver on the ASK programme as well, which is apprenticeships. For National Apprenticeship Week, I've got a whole series of events. And on the Tuesday, I'm doing an industry day, and I wondered if any of you would like to support the industry day for the health and care sector. So I've got group of employers, 10 minutes, and then we're going to do a Q&A with students. And I think the information that you've just given, I think it desperately needs to go out to our students. And I think in Apprenticeship Week, that would be ideal.
Yvonne, would this sort of type of presentation, if we could deliver the same thing and people are available, be what you're looking for?
Well, it'd be more round about the apprenticeship. So you'd get 10 minutes. And if you've got an apprentice that would come along as well to support you, and then the students can ask your apprentice, why have they gone into that sector? Why are they doing an apprenticeship rather than going to university? And also the different routes, because you've really explained well this morning the different routes and how you can, you know, you can go into one area, but you can branch out. And that's what students ask, because a lot of the students I work with think that health and social care is just working in a residential nursing home, and you know, and we know that's not that.
Yeah. Okay, and I'm sure I'm speaking for colleagues here, but I'm sure we can. I can see Rachel nodding her head and Nigel. So and you're the only two on my screen, so I'm sure everybody else is as well. So perhaps could you put your email address in the chat, and then I can pick it up with you offline, and we can arrange to be part of that.
Yeah, certainly. I'll put that in the chat now, because I'm just in the middle of pulling it all together. So that would be absolutely fantastic. I think what you've given today is fantastic. We just need to get that out to students, and we will be inviting Southend students along to the presentations, and also the invites will be going out national, because it'll be going through the Amazing Apprenticeship comms team. So we just don't know who we're going to get on the calls that week.
Fab, thank you, Yvonne. Another quick question, but this was just one from me, was if you have an internal employee who's been working for you for a little while and then they decide to do the apprenticeship, do they get a pay decrease or dock because of their taking on the apprenticeship? No, I'm getting a shake of the head.
I'm happy to say that how it stands within EPUT, if someone's actually already employed on an agenda for change contract and decides after 6 months or a year if they're going to go through and want to actually take up a development opportunity, they continue to be paid at the same rate they were because they're doing the job.
Okay, fab, thank you. And then we've got one other hand up. I think it's Fiona, but correct me if I'm wrong.
Yeah, morning. Fantastic session. So thank you very much. Without wishing to overload you with requests, we're running a virtual jobs fair on the 10th of Feb, which is targeting residents in Chelmsford, Malden and the surrounding areas. I'm conscious it is apprenticeship week, you're going to be very busy. So wondering if maybe we could use part of this session as a pre-recorded contribution to the event, and maybe if one or two people were available online to be part of the live chat. So what you've delivered today, if we could use that, that would negate the need for another recording. But if you are interested, maybe somebody could contact me, please.
Yeah, Fiona. What that was Fiona, wasn't it? Sorry.
Yes, it was. It was Rachel, yeah.
And what date is that again?
It's the 10th of Feb.
Yeah,
we're promoting it through all the promotion is going to be through social media and targeted at residents in those postcodes, so it could be really good target for you.
Okay, yeah, I'll contact. I've got your contact details, so I can contact you outside the meeting, and perhaps a couple of us could volunteer to attend that session. I'm sure that we can work that out. That's fine.
Thank you very much.
Thank you. We've got one other question in the chat, and it was, I work in North Essex, Colchester and Tendring. Will our local NHS partnership be offering the Health and Care Academy to our local schools? Is that how it works, or?
Yes, so I can answer that. I've got the benefit of knowing North East Essex because I used to work there. So they do have a Health and Care Academy there already. Theirs is already launched and probably a good year into being available to people. So I can definitely put you in touch with, in fact, I think they've got some, I heard a presentation from them recently, and I think they've got some planned for January time, some sessions that students can book onto. So who was that in the chat that said that? It was Yvonne Archer. Yvonne, if I perhaps contact you and put you in touch with the lead for North East Essex, and they can let you know all about their academy and their offers. It's a very similar offer. I actually was part of setting that one up, so I know it quite well. And I am aware that it's still running and they've got some sessions coming up. So does that answer your question, Yvonne?
Thanks, Rachel. Yes, it does, because obviously we work, particularly sort of the Clacton areas, there's an awful lot of sort of care homes and things. So, I think those local schools would really benefit from having that sort of input. So that'll be brilliant. Shall I put my email address in the chat?
Yeah, yes, please. I was just trying to find it there, but I can't see it. Yeah.
All right,
great.
yeah, now I'll do that. Thank you.
So really conscious of the time, we've got one more hand up, so we'll do one more question, but thank you everyone for staying on the line, to our guests and attendees. But I think it's Sarah Cottrell that's got your hand up.
Thank you, Rosie. Absolutely brilliant session. Thank you, everybody. Really informative. Yeah, it's just a really quick one. Yvonne, I run and manage the Halo Southend Introduction to Health and Social Care programme in Southend. We do have some care providers with some apprenticeships. I'm sure they'll be happy to come forward and support your apprenticeship week. I've got your details. I'll send you some information. And the other thing, I just wanted to touch base with Jane Sweeney. Thank you for the information on primary care. We've working with Kevin Garrard with regards to CRF South and Ambitious document funding from come sort of February, and we've added an NHS week in our Halo programme. So that will be obviously merging with a whole week with students, candidates to look at all the opportunities in Southend and obviously other settings. The primary care I will merge into that, so that's really helpful. Thank you.
Brilliant, thank you.
Oh, that's been absolutely great, everybody. Thank you so much to all of our guests today for presenting all in one place, and we've now got one presentation and recording that we can refer to. So thank you very much for your time. It's really, really appreciated. And are you guys happy for me to circulate your contact details, or contact details and presentations will be circulated after the call? So thank you very much, everybody, and have a lovely morning.
Thank you.
Thank you.
Bye bye.
Thank you. Bye bye.